Hello, everyone, and welcome to another episode of Heart Talks. In this episode, I've got a very special guest from across the pond. I'm joined by Michelle Routhenstein, who is a preventive cardiology dietitian and nutritionist based in New York. Hello, Michelle.
Hi, thank you so much for having me.
No, it's a real pleasure. Thank you very much for making time for this. Michelle, I've got lots of questions for you, but I really want to start off firstly with your training, because I'm very familiar with how doctors get trained in university and beyond. I just wanted to ask you to tell us a little bit about, firstly, why you decided to pursue nutrition and become a dietitian, and then tell us about your training and what that entailed.
Definitely. I'll start with the training and then I'll kind of go into why I chose this as my passion and career. Becoming a registered dietitian has a lot of schooling. So, you have to do a coursework of an undergraduate or a post-bac program where it's an intense understanding of nutrition. So, it's a lot of biochemistry and chemistry and a lot of science, very similar to a pre-med track, but more geared towards nutrition and metabolism. And then after you do these DPD requirements, these dietetic practice requirements, you have to apply for a residency program within nutrition, which essentially is a vigorous, anywhere from 12 to 16-month program where you're in the hospital and you are rotating between cardiology units and neurology units and oncology and all these different types of clinics in order for you to get a good grasp on all the different nutritional implications within them. And then afterwards you have to sit for a board exam to get your registered dietitian certification or license. And then there's also a requirement of getting a master's degree alongside that. That's a master's degree in clinical nutrition, in order for the science-based evidence approach to your field. And so that there's a lot of training that goes behind being a registered dietitian. And a lot of times, many people don't know the difference between a nutritionist and a dietitian. A nutritionist can be someone who took a course for 6 weeks or 6 months, who knows about general nutrition, versus a registered dietitian knows more about chronic disease management and has a lot of science behind those implications. So we know how to look at your medications and your lab work and ensuring that we are addressing all of those aspects in order to truly reduce chronic disease and help manage and prevent it going forward. The reason why I got into nutrition is I've always wanted to do something in medicine and I always wanted to be a doctor. And so I went to New York University to become a physician. And I was also, but you can't major in pre med. So I was a major in nutrition, but taking pre med courses. And I was getting into my junior year, in the middle of my sophomore to junior year. And my father's like, Michelle, like, you can't do both because you can't do a nutrition residency and a doctor residency. You can't do it. You have to, kind of go one way or the other. But I was kind of torn. Well, which way do I want to help people? And so I was in the hospital setting and I was following a dietitian. And I went and I spoke with someone in the ICU who had just, this 35-year-old male who had a bilateral amputation. They had to, because of uncontrolled diabetes. And this really struck a chord with me. And because I was just talking with him, and he said, I've been following my medicine regimen, and that's what I was doing. I was doing everything I was told to do. And now this happened to me. And I was like, well, did anyone ever talk to you about diet or the preventative aspect of it? And he's like, no. And that really struck a chord because we treat and we don't necessarily prevent complications or talk about the prevention piece. And so we really need to. And when I was in my residency going through oncology, neurology, kidney clinics, all these different areas, it always bottled down to heart disease. People were having heart disease complications or who were passing away from heart disease or having heart attacks. And I was like, why is this happening? And when you look in the research, it's the number one killer globally. Yet the research shows that 80% of it is preventable through science based nutrition and lifestyle medicine. And that's really where I was like, we need to address this. And so when I specialized in this, I realized a couple of things were red flags in terms of why we aren't catching this early enough. A, we're not being as strict as we can be or informative from a risk stratification standpoint. But on top of that, we aren't really addressing blood vessel health. You can say eat healthy, but what does that mean when it comes to the blood vessel? And so my education and my guidance with my clients is really looking at how do we optimize blood vessel health. And what I'm looking to do is ensuring that we're addressing vascular tone, we're addressing good blood flow, we're avoiding these excess cellular waste products like LDL and triglycerides and blood sugars to remain in the bloodstream to cause plaque in the artery. And we're avoiding this stiffness in the arteries that can cause rupture of pre-existing plaque that can lead to a heart attack and stroke. So I'm going to the underlying root causes of cardiovascular disease in order to ensure that we are really optimizing your cardiovascular function. But the first step that I always tell everyone is you need to know your numbers and you must be proactive in your care. I love physicians. You guys, and physicians do such an amazing job in so many aspects, but we can't always, I feel like a lot of times clients expect the physician to do to help them and guide them with all of these things. And at the end of the day, it really lies down on the individual of being empowered and asking questions and working with their care team for optimal care and optimal control of all of these chronic conditions.
No, that's so interesting to hear, firstly, how the training aspect of a dietitian nutritionist is, but also how you ended up in specializing in cardiovascular disease. Um, can you tell us what happens when a client or a patient comes to see you? What is your approach? What is the process that you go through with them?
Yeah. So when I see my individual clients, I have them before we meet send me their lab work. And I like to look at least 2 or 3 years of lab work because I like to see trends. Many times, many values are very wide in what's normal. And so what's normal for you might not be normal for someone else. So I like to look at trends. So I look at their blood work. If they're taking any medication, I'll ask them to send them to me. If they're taking any supplements, I ask them to send me the labels so I can review all of this information prior to us meeting. This helps me in any medical information. So if someone had a calcium score done, or if they've had bypass surgery or they had discharge papers, I like to review it all before we meet because I can then kind of pair and make connections of what's the driving cause of their cardiovascular condition. Is it inflammation? Is it insulin resistance? Is it what's going on? And so I look at all before we meet. And then in our first conversation, in our first meeting, it's a 90-minute comprehensive evaluation. And this is where I get to know my clients. I want to know the ins and outs of their lifestyle because you can't just take a piece of paper and say, here, everyone needs to follow this, have a good day, bye bye, because it's not personalized. And food is not, we don't eat like a robot, right? We have to take people's cultural and food preferences and their lifestyle and their accessibility and their desire and want to cook or eat out or what that looks like and merge the science in there in order for a long-term implementation. And so I do a very thorough analysis of their nutrition for vitamin and nutrient deficiencies, but also what might else be causing issues like sleep and stress and physical movement and hydration. We have to look at everything. And so I do a very comprehensive evaluation so that way I can go home and I can create a roadmap for my clients that's very personalized to them. because we can't look at something at diet and nutrition as, oh, I'll do this for a month and I'll be fine. Heart disease is a progressive disease. And so we need to make sure it is a long term game plan and that we're creating these long term habits. So after I do all of that, I present to my clients a health resource guide and a meal plan in our second 90-minute session. And then we choose 3 to 4 goals to hyper focus on. And we meet bi weekly, either 2 times, 4 times, 6 times, depending on the program and their goals. And in those follow ups, we address all the challenges. We'll deep dive into food labels or restaurant menu reading or anything that my client needs more assistance with. Because at the end of the program, I want people to feel confident in their nutrition choices. And so it's a very hands on program that takes the science and their lifestyle and merges them into one for long term success.
That's really, really interesting. And what I also find interesting with your work is the demographic that you deal with. I mean, you're based in New York, and I've been to New York. I was there for a couple of weeks just before the pandemic, and what I noticed was that the population demographic is quite similar to London and the major big cities. You mentioned cultural differences, and of course, there's a huge cultural aspect to food and eating, as well as lifestyle. But from your clients and from your experience, what are the main challenges that you find that clients struggle with the most when it comes to really looking at their diet and their nutrition?
I think people love quick fixes. So everyone's like on the bandwagon, like, oh, the keto diet is really important. Oh, intermittent fasting, I should do that one. Or I'm going to take this supplement or this magic pill. And we go into these extremes of removing a whole food group or doing things too quickly. And then it doesn't last long term. So they just give up. Right. And we need to look at it from a standpoint of we need to change habits and we need to assess what works for you in that moment. So I'm very big about reducing the overwhelm of a cardiovascular healthy diet. We often focus on all the foods we cannot have. And so at A1, we want to have it that much more. But I want to focus more on, well, what can we add into whatever you're already doing to enhance its ability to be beneficial for you? And so when we look at cultural diversity, that's a really big element. It's, for instance, I deal with a lot of South Asians. I cannot, if someone tells me that they only eat curries or they eat certain types of foods, to tell them no, you have to change to this culture is not going to work long term. So it's like, okay, well, what are you currently doing, and how can we enhance those elements to get in those therapeutic foods and still allow you to enjoy food? Heart healthy diet is not a bland diet. It's not a unflavorful diet. I love food and I want all my clients and everyone to still enjoy the aspects of eating and still really appreciate good flavor. And so we need to make sure that we are still keeping things flavorful, but doing it in a heart healthy way that can be sustainable.
Yeah, and you mentioned there about a lot of diets that become quite popular. I mean, there is the keto diet. There is more recently that's been spoken about a lot is the fasting. Um, you mentioned that there is no one size fits all. What would be your message regarding these diets? Every month there's a new trend. What would be your advice, being in the field?
If you can't do it, if you can't sustain it, it's likely going to ruin your metabolism and it's probably going to cause some nutrient deficiencies because your body's not satisfied in them. So take a stand back and think about it before you jump on the next bandwagon. I also think it's important, and this goes back to my point of people want quick results. They want that magic pill. We know from a cardiometabolic standpoint, if one of your goals is to lose weight, but you lose a lot of weight really quickly, and then you keep weight fluctuating, so you lose a lot quickly, you can't sustain it, so then you gain weight and maybe even some more weight, and then you constantly going on this yo-yo. It actually causes a lot of detrimental effects to your heart health. It can increase blood pressure, it can increase triglyceride levels, and it can wreak a lot of havoc on your organs. So we want to make sure that we are doing things in a more sustainable and slow and steady manner. We also know that those extreme diets cause these weight fluctuations that can actually lead to scarring on the liver and cause gout attacks. So we need to take a stand back and realize that if weight loss is a something you're trying to achieve, it needs you didn't gain the weight overnight, so you can't expect to lose it overnight. And to do that can really harm your body. And so we have to take a stand back and say, is this realistic? Is this sustainable? And how do I feel? When people go on the keto diet, the first thing that people feel is really crappy because they go into a keto flu, like that's what they call keto flu or keto survival phase. Why is that happening? Because ketosis is a survival mechanism. Your body goes into ketosis and uses fat as primary fuel when it doesn't have any carbohydrates. And the reason why is because your brain uses carbohydrates as its primary fuel. If it's not available, it goes to the next source of food that you're giving it. So it's going to take fat and it's going to metabolize it into blood sugar for your brain support, and then you go into ketosis because you're developing ketones to make carbohydrates. Your body is, you get brain fog, you get irritable, you get moody, you get this keto flu because your body can't process fat as quickly as carbohydrates. And so that feeling of really crappy is a sign your body can't handle that. It's a survival mechanism. So if you feel really lousy on a diet, that's a red flag that it's not working. You should feel energized. You should feel more clear headed. You should feel like you have more stamina, energy, productivity when you're giving your body the nutrients it deserves to do all of these metabolic functions that are quote unquote behind the scenes because we don't see it, but it's doing so much every single day. And we need those vitamins and minerals for optimal function and our optimal heart health.
Yeah, that's really, really interesting. And you spoke about the keto diet. Just for people who may not understand what that is, can you just briefly explain what is the keto diet? I think you kind of alluded to that.
Yeah, so the keto diet is having a very, very, very minute amount of carbohydrates. And because your body, so when you are not having enough carbohydrates, your body needs to figure out a way to produce carbohydrates in order for your brain to function. So when you consume high levels of fat and high levels of protein, it's now your body has to break down the fat and protein into carbs. And so you go into this ketotic state. From the research, we know that it's helpful in epilepsy and in that disorder, the seizure disorder category. But from a cardiometabolic standpoint, you are depriving your body of fiber, nutrients, and increase in TMAO, which can promote atherosclerosis and cause a lot of abnormal lipids as well. So from the true sense of the keto diet, it's not a cardiovascularly healthy diet, and we are removing an essential food group that our body needs to thrive and to receive certain vitamins and minerals.
Sure. And for people who may be watching and wondering, there's so many diets out there, but my priority is to improve my cardiovascular health, so improve my heart health, reduce my risk of developing a stroke. So what should I be eating?
Yeah. There's so many foods that we want to actually include in the diet, and that's really important. We have to look at it from a sense of balance. So I look at it as we need to concentrate on fibrous vegetables, but specifically ones that help certain pathways in their body, which is the nitric oxide pathway, the glutathione pathway, which help to quench free radical production and help with the opening of our arteries. So things, for example, like asparagus and beets and cabbage and cauliflower and broccoli, those are really rich in those nutrients that help with that. We're also looking to have a good source of lean protein in our diet, and specifically like plant based proteins alongside omega 3 rich fish. Looking to get in whole grains or a starchy vegetable that will assist with getting enough B vitamins and magnesium. And also a small amount, but a crucial importance of a heart healthy fat, like our monounsaturated fats from olive oil and avocados and nuts and seeds, because that's going to help absorb fat soluble vitamins. But on top of that, will also help with just optimal satiation and helping to absorb fat soluble antioxidants that our body needs also from an anti-inflammatory standpoint. So a lot of different things. And when we talk about heart health, I think it's also important to note that we're really trying to reduce our risk of heart attacks and strokes when we think of this. But we're also, depending on your risk factors, your conditions may need to add in certain other elements. For instance, if someone has atrial fibrillation, we need to ensure you're getting the nutrients you need for optimal heart rate regularity. If somebody has heart failure, we need to make sure that we're really addressing oxidative stress, because that's even more increased than that patient population. If you have familiar hypercholesterolemia, we need to look at all the fats you're consuming and seeing how your body is able to metabolize them. So there's a lot of different things that might need to be honed in on depending on the heart condition. And I think a lot of times we group all heart healthy diets into one, whereas we need to not, all of them are not going to contradict another thing, but we might need to hone in on a certain aspect of certain heart conditions, in order to optimize that person's ability to optimize their heart health.
So that's what people should be eating to optimize their heart health. What should people avoid? What is not good for the heart?
So we know from so many research studies that red meat and processed meats are going to increase cardiovascular health. This is from a standpoint of it's very high in saturated fat, which clogs the arteries. But it also, even if you were choosing very lean red meat, it is high in TMAO. So when we consume it, it can promote plaque formation in the arteries. So we want to reduce that as much as possible. We know that excessive alcohol consumption, of really drinking more than one glass of any alcoholic beverage more than 2 to 3 times a week, is detrimental to cardiovascular health. Things that are very high in saturated fat, very high in refined sugars, we want to reduce as much as possible as well, in order to avoid the clogging of the arteries as well. I also like to mention, because I feel like many people think that supplements equal natural foods. I don't know in London if they're regulated, but in the US, they're not regulated. And many of them have additives and fillers in it that are very pro inflammatory, that can cause an increase in byproducts in the blood vessel. And so we also need to look at that as part of our assessment of what we're ingesting and how it's affecting our bodies.
Interesting. And you mentioned foods that are anti-inflammatory. So could you just explain what are foods that cause inflammation? What is inflammation, and how can food reduce inflammation in the body?
Yeah. So inflammation, from the sense of it, is there's two different types of inflammation. When you get a cut on your hand and then you see that it's starting to get red and all this, your body is trying to heal the skin so that you're not getting, any infection, or you're creating, repair of the scar tissue, so to speak, right? But so that's natural. We don't want to prevent that from happening. That's a protective element. When we have a virus, our body is going to go into a higher inflammatory state to help to combat that virus. That's normal. The issue becomes when we have low grade systemic inflammation from uncontrolled and unmanaged chronic conditions, such as high blood sugar, high blood pressure, high cholesterol levels, abdominal adiposity, fatty liver disease, gout, all of these parameters that can cause the low grade inflammation. And when we have low grade inflammation, it's going to make whatever is excess in our bloodstream more susceptible to being oxidized and leading into plaque formation in the arteries. That's what we really don't want. So, in order to reduce inflammation, one of the key parameters is controlling all of those laboratory parameters. We need to ensure that we are reducing all of those risk factors, those modifiable risk factors, because that's going to be something that's going to brew inflammation. When we have excess adipose tissue, so when you check your waist circumference and it's above 35 inches for a woman or above 40 inches for a male, and these are lower in certain ethnic populations, that's also a bruise site for inflammation. We know that visceral fat, the fat around our abdominal region, is more metabolically active, and it's going to cause more of these inflammatory markers to increase in the body. So we need to first address those. The second thing of what we do to decrease inflammation is ensuring that we are adding anti-inflammatory foods. This is really primarily in our omega-3 category, if I had to kind of hone in on one aspect of it, but it's also on our gut health. We know that our inflammation can really happen if our gut health is not optimized. So I would look at foods from omega 3s, which is our EPA and DHA from our omega 3 rich fish. It's our alpha linoleic acid from our plant based omega 3s, which are walnuts, flax seeds, chia seeds. Um, and then I would also look at our gut health. How are we eating in terms of our probiotics and our prebiotics, our fermented foods to help with making our gut microbiome strong, and then the food that feeds those guts bugs to continue to flourish and diversify. And those two elements are really important. There's a lot of other things that also can decrease inflammation, but I would start at that point in order to help with reducing some inflammation in your body. But we need to address the underlying cause. So if you have high uric acid levels and you start eating fish, that's not necessarily going to reduce your inflammation, because we need to lower your uric acid levels in order to reduce the systemic inflammation. If you have high homocysteine levels, we need to address that in order to lower inflammation. So it's not such a blind answer of, oh, if you just eat this, all of your inflammation will go away. We need to see what the source is. And that's why I look at everything in the picture, so that we're not missing any key components to ensuring that you reach your goals.
Yeah, I mean, in terms of making these changes, these dietary changes, it can be quite challenging, can be quite difficult. I mean, taking a pill, taking a medication is relatively easy. You just add it to whatever else you're doing. But taking things away and completely changing your routine for some people can be quite hard. How do you motivate someone who may have tried to eat better for about a month and then they kind of go back to their old ways? How do you motivate them? How do you encourage them to maintain that lifestyle?
Many things. First off, you don't need to do all of it at once to see results. That's really important to say, because we expect, okay, well, many people are motivated based off of their labs or their recent diagnosis or a family history that they're anxious about it. And they're like, you know what? I'm motivated because of an internal need to be motivated. But I look at it as a sense of, when people are feeling fatigued or they're feeling tired all the time, that's a sign your body is not getting the nutrients it needs. And so by looking at it, well, I want to feel better. That's usually a common thing. Like, I want to feel better, so I need to do this. And then taking away the overwhelm. You don't need to do all of it at once. Start with breakfast, start with lunch, start with a snack, start with one thing. Or maybe it's not even nutrition related. Maybe it's your sleep hygiene or your stress or your exercise that you are starting with. And then once you have one thing that anchors your day into getting you on the right mindset, then you can start adding another one and another one. And before you know it, over many weeks' time, you've incorporated a lot of healthy habits and you're feeling better. And when you start feeling better, you are more motivated to continue doing it that way. There's like this ongoing joke. A lot of my clients will come to me and be like, oh my God, Michelle, I feel so much better because of all these nutrients I'm adding into my diet. And then, like, this weekend, I went out and I traveled with a friend and I ate so poorly. And oh my God, it feels so bad. I feel so lethargic and my body is so upset at me. He goes, now I'm back on Michelle's because I don't want to feel that way. And I always apologize. I'm like, I'm sorry I did that to you. He goes, no, like, I didn't know. I thought that this was part of aging, they always say. Like, oh, I thought that when you get older, you just get more tired and you're slower. And he was like, no, I wasn't eating the foods I needed to eat for proper energy and proper metabolism and just for my body to work better. And so when you start feeling better, that's the motivation that keeps you going. But you have to start somewhere. And to start too overwhelming can actually offset your goals. So I always say start with one small thing, and then we can start increasing and you'll start feeling better. And that's going to keep encouraging you to continue your journey.
Uh, like I always say, slow and steady wins the race.
Exactly.
On that note, I've learned so much. Like you say, doctors, we're not really trained to tell people what to eat and what not to. We give general advice. In the cardiology guidelines, as you know, they suggest the Mediterranean diet. What's the Mediterranean diet? So, that's the advice we give. But it's so fortunate to have dietitians and nutritionists like yourself who we can refer patients onto to get that specialist advice and that focus, to really advise them on how to not only make those small changes that you spoke about, but also how to maintain it with your knowledge and expertise. So thank you so much, Michelle, for making time for this. Can you tell us where we can find you? And of course, I'm going to link all Michelle's social media and contacts in the comments below.
Yeah, well, thank you so much for having me. You can find me either on my website and my blog at entirelynourished.com, or you can find me on Instagram at heart.health.nutritionist. Happy to answer questions or anything. Just feel free to send me a message.
Fantastic. Thank you very much again, Michelle, and thank you all for watching. Don't forget to subscribe and hit the bell icon and check out Michelle's social media and website, which will be listed below. Thank you.
Thank you.